All right, let's dive right into this explainer. Today, we're unpacking the hard, data-driven science behind Lignosus rhinocerus, which you probably know better as the tiger milk mushroom. We're looking at a genuinely fascinating systematic review evaluating its potential as an anti-asthmatic agent. Look, if you're interested in respiratory health, pharmacology, or just how natural therapeutics actually work on a granular cellular level, you are going to love this. It's a highly compelling biochemical journey. We've got a pretty structured agenda to get through. We're going to cover the global asthma challenge, look at TLMM as a natural adjunct, dive into the in vivo data, explore the in vitro mechanisms, review the human clinical trials, and finally wrap up with future directions. Okay, starting with Section 1, the Global Asthma Challenge. Let's pull back for a second and establish exactly why medical researchers are so urgently exploring new complementary therapies in the first place. Asthma isn't just some localized issue, it is a massive global health burden. In developed countries alone, about 1 in 10 people are diagnosed with it. And think about this. By the year 2025, an estimated 100 million people in these nations will be affected by this incredibly complex inflammatory condition. For someone actually struggling to catch their breath, this means severe airway constriction, deep inflammation, and even long-term physical structural damage to their lungs. And that brilliantly illustrates our current treatment gap. Standard therapies like inhaled corticosteroids and beta-2 agonists are absolute mainstays, right? They are literally essential for symptomatic relief. But their long-term use definitely carries risks like tachycardia, a persistent cough, and oral thrush. On the flip side, when you look at severe asthma treatments using biologics, they are incredibly expensive and can even carry risks of anaphylaxis. So this reality is exactly what's driving the intense hunt for natural, accessible adjuncts that can soothe airway inflammation, but with way fewer side effects. Moving right along to Section 2, TMM, a natural adjunct. This brings us to a really compelling candidate originating from Southeast Asia. Now here's where it gets interesting. The mushroom's therapeutic bioactivity isn't actually found in the cap or the stem you might picture above ground. Nope, it is concentrated completely underground in the sclerotium, this nutrient-rich mycelium reservoir. Phytochemical profiling shows this exact part is absolutely packed with water-soluble beta-glucans, complex polysaccharides, and phenolic compounds. Basically, these are the heavy-hitting molecular drivers behind its potent anti-inflammatory effects. Just to anchor ourselves in the actual data, we are evaluating a recent systematic review that utilized a super rigorous PRISMA framework. The researchers sifted through 182 global publications and ultimately distilled them down to just 9 high-quality studies. That's 8 preclinical animal models and 1 human trial. Section 3, in vivo data, immune system modulation. Let's zoom in on those preclinical animal models to observe exactly how this extract is altering the asthmatic response at the biochemical level. So asthma is essentially a malfunctioning, totally overactive immune response. Across the animal studies, the mushroom extract powerfully suppressed this immune storm. It significantly downregulated Th2 cytokines, specifically IL-4, IL-5, and IL-13. Think of these cytokines as the primary conductors of the inflammatory cascade. By silencing them, the extract drastically reduced IgE antibodies and literally stopped eosinophils, which are the white blood cells that swarm in and damage airways, from infiltrating the lungs in the first place. But wait, it doesn't just stop the immediate immune swarm. Prolonged inflammation causes what's known as airway remodeling. This is where the airway walls actually thicken, goblet cells multiply out of control, and mucus overproduction completely clogs the lungs. The data demonstrates that tiger milk mushroom extracts significantly reduce TGF-B1 and activin A. Those are the very cytokines driving this fibrosis. So ultimately, it appears to be actively protecting the long-term structural integrity of the lung tissues themselves. Halting inflammation and protecting tissue is absolutely vital for sure. But if someone is actively having an asthmatic response, we have to ask the really critical physiological question: does this intervention actually relax and open the airways for immediate symptom relief? Which brings us to Section 4, in vitro bronchodilatory mechanisms. Let's look at the isolated tissue data and see how this builds a truly fascinating case for mechanical airway relaxation. In vitro studies on rat and guinea pig tracheas yielded an incredible discovery. The extract fully relaxed artificially contracted airways. But how did it do it?
Well, smooth muscle contraction in the lungs relies on a massive influx of extracellular calcium ions. The tiger milk mushroom extract literally blocks this calcium entry. This is a huge revelation because it means it achieves bronchodilation entirely independently of the beta-2 pathways used by your conventional inhalers. It is a completely distinct physiological mechanism.
Now, the systematic review highlights a really vital nuance here. Processing matters. Hot water extraction effectively captures those water-soluble beta-glucans, but cold water extraction preserves high molecular weight polysaccharides that are usually destroyed by heat. And the data shows these cold water fractions actually demonstrate superior airway relaxation at significantly lower doses. It really emphasizes just how critical the extraction method is to the actual clinical potency. All right, Section 5, Clinical Evidence in Humans. Now that we understand the granular cellular mechanisms, let's zoom back out to the macro level and examine the clinical data we actually have in humans. Looking at the human trial conducted by Tan and colleagues, participants took 300 milligrams of oral tiger milk mushroom twice daily for 3 months. The physiological outcomes were pretty striking. A 27.2% improvement in their FEV1/FVC ratio. For context, that's a primary measure of how much air you can forcefully exhale, so an almost 30% jump is huge. Biochemically, the researchers also found marked decreases in potent inflammatory markers like IL-1 beta and IL-8, as well as a drop in MDA, which is a key biomarker for oxidative stress and cellular damage in the lungs. Finally, Section 6, Limitations and Future Directions. As with any rigorous scientific overview, we have to objectively address the boundaries of the current evidence. We have to be realistic here. While the biochemical data and that single human trial are incredibly promising, the evidence base remains predominantly preclinical. Right now, there is only that one published human clinical study included in this systematic review. Furthermore, the variations we talked about in extraction methods, hot versus cold water, and the different dosing schedules across studies make it really complicated to standardize a universal treatment protocol. So we cannot yet formally integrate this into routine clinical asthma guidelines. What is desperately needed next are large-scale, rigorously designed, randomized controlled trials to truly validate safety, efficacy, and ideal dosing in human populations. However, the researchers make one incredibly compelling final point that I want to leave you with. We already know that conventional calcium channel blockers, when delivered systemically, can cause unwanted cardiovascular side effects. But what if we took this natural, calcium-modulating mushroom extract and localized it directly into the lungs? It leaves us with a highly provocative question. Could an inhaled formulation of tiger milk mushroom literally become a future cornerstone of respiratory medicine, offering powerful bronchodilation without the systemic side effects? The science definitely points to a fascinating horizon.